All right, welcome or welcome back to my channel, guys. This is Nursing with Nantha. Oh, excuse me. This is Nursing with Nantha. So, this is like take number 52,011. There's been fire trucks that have gone by, ambulance. The dog has been barking like she has lost her ever-loving mind. Like, what? What is going on? But I'll try to get through this video this time. So, I just wanted everybody to know the importance of speaking up for your care. What I mean when I say that is if your doctors, nurses, or anybody in the healthcare field tells you something that like you don't understand, it's not making sense to you, speak up. Say that you don't understand. Say that you need some clarification. So that way you can avoid having issues later on down the line. Case in point, I've been going through some health stuff since October of last year, and I had the experience with one physician who I really just felt like she was blowing me off. That don't always sit too well with me. I'm trying to, let me pause. I'm trying to make this video where it doesn't come across like, I'm irritated, I have attitude or anything like that. But there are just some things as a nurse that I don't like the way that things go down. And it irritates me because I wouldn't handle somebody else like that. But my therapist says I gotta stop expecting me from other people. So the situation that happened was, you go to a doctor and they ask you, well, what brings you in here today? Well, she was asking the questions, but she didn't want to hear the answers. And what I mean by that is she's not letting me finish the sentence. And when I say something, it was just like, oh, that's normal. Oh, that's normal. Oh, girl, you're a nurse. We don't pay any attention to that. That's not that serious. And I was just kind of like, So I didn't say anything then because I was too upset in that moment. And I'm just gonna have a very honest and transparent moment. My attitude can go from 0 to 10,000 that fast. Like, it's I'm very black and white. There are very few gray areas with me. And I don't really play about my health. Like, I make sure that I take care of myself and do what I'm supposed to do so that I don't have, major health issues. And the time that I'm actually having a major health issue, this is the treatment that I'm getting. And I didn't like it. So I made up in my mind right then, I wasn't going to have any more interaction with this lady. I was going to try to find another cardiologist and go on about my business. Because, like, ma'am, you're not going to kill me. And you're not going to over-medicate me. Like, we're not doing that. So I go to my primary care doctor for my well woman's checkup, your annual checkup. And I'm, talking about all the stuff that's going on health-wise, in this one appointment. And I'm sitting there, and all of a sudden I could feel my heart start to skip beats, and I got short of breath, I got dizzy and lightheaded, and all of the things. And my heart is beating fast, but it's skipping beats. And I'm just sitting there, and the doctor's looking at me. She's like, are you okay? And I said, just give me just a minute. I was like, this happens it happens every day. I need to breathe through it, and it'll go away, and I'll be all right in a few minutes. And she's like, well, that's not normal. You're not doing anything. And I said, yeah. I was like, this is what I've been dealing with. Like, I talked to the cardiologist about it, and she literally said that this was normal. I was like, you and I know that it's not normal, but it wasn't like something that wasn't manageable at home for me. Me only. If you are experiencing those things, call your doctor, go to the emergency room, do all of those things, okay? But for me, I was like, I'm all right. Like, I'm okay. I know if it gets to a certain point, I'm calling 911, somebody's coming to get me or whatever. Anyway, so I I'm having this conversation, and she's like, well, I need you to go back to the cardiologist because you're not supposed to be like this. And I was like, okay. And I was like, but she said, now you have one of two options. You can go back to the cardiologist, or I can send you a referral to somebody else. And I was like, yeah, I just wasn't feeling her. I was like, that's why I haven't called her back to let her know any of this stuff. I was like, because she was kind of blowing me off and I didn't like it. And my doctor was like, okay, I'm going to send you this referral. She was like, that's what I would do if it was me or if it was, you know, one of my family members. I was like, okay, cool. So I go see the cardiologist today. And I have another one of those episodes in the cardiologist's office. Normally this happens like if I'm at home, it happens while I'm driving. I could just be sitting still, not like it has no rhyme or reason to why it happens. It just does. So this time it happened again in front of the doctor's staff. I believe she was a medical assistant or a nurse. She was one of the two. I didn't look at her name badge. But it happened in front of her. And she was like trying to hurry up and get the EKG on so she could try to catch it if it was some abnormality in my heart rate or the rhythm. And she didn't catch it because you got to put a lot of leads on, like it, and it happens so fast and goes away so fast that you can't catch it. So the doctor comes in and I'm explaining to him what happened, and he's like, well, you've seen a cardiologist before, right? And I was like, yeah. He said, did you tell me? I said, yeah, but she blew me off. I was like, so I just never went back to her. And he was like, well, I don't think she did her due diligence. I don't think she did a good job because this is not normal and this is not okay, especially for somebody who's fairly healthy and your age. That's not normal. So there's some things that we need to look into. Which brings me to, this is what we have to look into. Make sure I don't expose my boob. This is a heart monitor that is being watched constantly, 24 hours a day, 7 days a week. It sends my rhythm rate and all of that stuff to a location wirelessly. Like they can see it. I can shower with it on and all of that stuff. They gave me a little booklet that I have to keep that says what my symptoms are, the day, how long it happened, and all of that stuff. I don't know if you can see that, but I haven't put anything in there yet. But the reason why I say it's so important is because clearly this is not normal. Like, I'm 47 years old. I personally don't have any heart issues. Like, all of the heart testing that they've done has come back fairly normal. So it wouldn't be a reason or a cause for this to be happening as frequent as it's happening. So when I say speak up for your care, that means if somebody tells you something that you know is not right, speak on it. If somebody tells you something that you don't understand, speak on it. As healthcare workers, we have the responsibility. We have an obligation to explain things to patients and their families in a way that a fifth grader could understand. That means that we're not using medical jargon and medical terminology to explain things to patients. If you have a physician's assistant, a nurse practitioner, any healthcare worker that is explaining things to you and they are talking to you in medical jargon or medical terminology, hey, I need you to explain that to me in a different way because I don't understand. I don't know what that means. I made mention of this back, I think it was last year or the year before that. It was one of the videos that I did. I know I'm very inconsistent. I'm sorry about that. But it was one video that I did that I was explaining how my dad had taken my mom to the doctor and he didn't understand. And I had to step in and tell the doctor he don't understand that. It's the same thing. Things get missed. Important, critical things get missed when we don't speak up and say, I don't understand that. I don't think that that's right. Can I have a second opinion? I'm going to get a second opinion. those are your rights as patients. You're paying for a service. If you're paying for that service and the issue that you have is not getting fixed, you have every right to go pay for that service someplace else and take that to somebody else that's going to actually listen and fix it. Especially in the African American community, there are so many health disparities that are happening with us, Black and brown people. We gotta take some sort of accountability and some ownership and say, you know what? I don't understand that. I need you to explain that to me in a different way. Okay, you're not giving me what I need as a patient. I'm gonna fire you and go to somebody else. You have that right, absolutely. Now, that logic does not apply to every situation, so I feel like I have to put this little asterisk by this statement. If you are hypochondriac, if you are drug seeking, if you are being a jerk to your doctor for just because you feel like you can be a jerk to people because there are some people that are out there in the world, that statement does not apply to you. Hypochondriacs, yes, I understand that you read things, you interact with people, and you see things, and you automatically think that it applies to you, and it doesn't. And that's okay. It doesn't apply to you. People who do have substance abuse issues, sometimes they do Dr. Hop just to get what they want. This does not apply to you. People who are just belligerent and think that they're supposed to get every single thing that they want whenever they demand it, and this does not apply to you either. Those are all special cases. I am talking about the person who has health issues that are trying to do right, that's trying to follow instructions, and they're missing the mark because they don't understand how things are actually working. If you run into someone who is not willing to sit down and take the time to explain those things to you, find somebody else who will. That's what I mean when I say speak up for your care. Don't be out in these streets acting like no jerk just because somebody was 10 minutes late with your pain medicine. That's not what I'm talking about. I'm talking about if the doctor comes in your room and they say, oh, you have cholelithiasis. Number one, spell it. Number two, tell me what it means and use it in a sentence. Just tell me my gallbladder is inflamed. Where's my gallbladder? It's on your liver. How do we fix this? Oh, you can have surgery or we could try antibiotics depending on what this like, those are the things that I'm talking about when I say speak up for your care. That's when you need to be like, I need to understand that you want to take me to surgery for this. Like, I gotta have surgery and I'm gonna be out for a couple of weeks. I can't lift it. Those are the things that I'm talking about. I'm not talking about the rambunctious patients that, just want to give people a hard time, because we run into those patients too. Me, it don't bother me. I'm getting paid $12 no matter what. I don't care about explaining things to patients because, again, I'm getting paid to explain things to you. I'm supposed to be your advocate. But I also need patients to learn how to speak up for themselves, because I'm not going to always be there. Every nurse is not going to be like me. So in those moments, you have to know, I don't understand that. Excuse me, say that to me different. Let me call somebody that might be able to understand, because I don't. That's what I'm talking about. I don't want what happened to me to happen to anybody else, because your situation could be more critical than mine. you could not wake up because somebody blew you off when you went to an appointment. I mean, technically, I guess I could have too, but, you know, I think I'm Superwoman sometimes, and that doesn't apply to me. But for all intents and purposes, like, let's learn how to have this partnership where I'm paying you, you explain it to me. If I have questions, you're receptive to answering those questions. If you don't get that, find somebody else. Like I said, I was trying to make this video short, sweet, to the point. I'm not going to tell you how long, like what the results of this is, because that just ain't your business. I was literally just trying to share and give you a reason why you need to start speaking up for your care and paying attention when doctors are talking to you and your interactions with them. I hope it helps somebody. As always, like, comment, subscribe, and share. Have a good night. Bye.